So what inspired me to do nursing? Well, when I was in Year 12, I did think that I was going to be a systems analyst, and all my subjects kind of led that direction. But I've worked out during this time I do prefer to talk to people, so I made a choice to swap to nursing because I do like to spend a lot of time communicating with patients. Currently, my biggest passion is treating patients with pain and making their journey in this hospital as comfortable as possible. I worked in intensive care for a very long period of time. Back when I was in intensive care in 97 onwards, if you like, for up to 12 years. I found that pain management was not the first priority in that area, and because these patients are acutely sick, it wasn't necessarily the first thing that people would think about. So for me, it was about how can I make this better in this area, and part of that was to jump into a role that did pain management and learn from that. And for a period of time, I was actually doing two roles. I was working both in intensive care and in pain, and they did overlap quite nicely. With the scholarship, I'm a single income person. I have a husband who doesn't work and I have a child, so for a part-time wage that goes to pretty much everything to deal with my family. So having a scholarship means a lot to me because it means that I can do something to advance my professional status through professional development, something that I wouldn't normally have access to. I think the impact will be quite vast in that we can spend more quality time potentially with patients in an area that they don't normally get a lot of time with. Our complex pain patients, for example, do have significant backgrounds in psychology, and understanding where they're coming from is a big factor in the exacerbation of pain in these patients. If we can upskill in these areas, I think we will actually impact how that affects patients, giving them more time in it. And then also then teaching and educating nurses the skills that are needed to help deal with these patients as a consequence. I'd like to say to the donors that support these scholarships that I'm really grateful for your input, because it will allow me to do further study in either psychology or leadership in particular, to really make the time spent with patients more valuable for them and give them extra things that they may need. We are very grateful that there are donors that do contribute to this scholarship, because it means that we have extra money that we can put for professional development, which will ultimately enhance how the patient receives the care from us.